Hey everyone, welcome to the Facebook Live. Today we've got Dom Mostert. She's a veterinary physiotherapist, and she's going to be chatting to us about a case of hers that's got canine hip dysplasia. And it's actually a dog that was doing obedience work and is now back in doing obedience again after Dom's wonderful treatment. So I just want to welcome Dom. Thanks for coming online to chat to us, Dom.
It's a big pleasure. Thank you very much for asking me.
Dom, do you want to tell us a little bit about yourself while we wait for people to come online?
Sure. So basically, when I was very, very young, I really found myself really enjoying working with animals, and I found Equine Librium in the HQ magazine, and I went up and had a look, and they had the most amazing facilities, and I enrolled immediately. And there I did 4 years of veterinary physiotherapy at Equine Librium, and have since come back to Cape Town after my studies. I then worked for just under a year at practice in Newlands, and then started my own practice. It's what I really, really wanted to do, is just start my own practice and be able to do what I enjoy.
Thanks, Thomas. We've got a few people online. So hi, everyone. We just want to check to see whether you guys can hear us and you can see us. So if you can give us some thumbs up, or if you just put in the comment section, we can hear you, so that we know that we can start. If you have any questions at all for Dom, then you can put them in the comment section. For those of you that are going to be watching the recording, you can still put it in the comment section, and I will get Dom to come online later on today just to answer your questions. So if anyone's there, if they can just put a little thumbs up. I see I'm just getting one of my team to check for me. Can hear Dom fine. Can't hear me. All right. Is it fine, Anae? Can you hear me? Anyone give me some feedback? Just going to quickly check to see that we are being heard. Sorry, Dom, we won't be long. We've been having. Okay, she says yes, she can hear us. Okay, all good. Dom, do you want to tell us a little about your case, and then we'll just start on answering all the questions that people are posting. And I've also got a few questions. It sounds like a really interesting case.
Sure. So basically, I've been asked today to speak about hip dysplasia. So one of my clients that I've got, it's a 5-year-old Pasenji cross husky, and her name is Lily. She's the most amazing dog, and she came to me in November, where she had been referred by the vet. So he had taken x-rays and discovered that she had hip dysplasia. And when I asked her now why was she originally at the vet, and she said that her dog does obedience, and they noticed that she starts lagging during some of her obedience work, during her training. She was struggling to sit down. And when she did sit, she'd kind of flop over to the side, so she wouldn't sit down properly. She'll flop over, and then one leg would come out. So she was really struggling with turning around the corners during her heel patterns. So we basically immediately started rehab with her, and it's really, really been a fantastic journey with Lily.
And what type of treatments have you been doing with her, Dom?
So basically, the biggest thing that I wanted to work on was pain management. So any potential discomfort that she was in, I felt the need to address immediately. So she had pet cam that she used on an occasional basis where she felt it was necessary. We put her on some joint supplements, and then we started working on exercises to strengthen her up. So basically, when a dog suffers from hip dysplasia, they start dropping off muscle in their hindquarters. So the reason why we need to put the muscle back and strengthen them up is to support the hip joint as much as possible. So we worked quite a lot. We put her into the hydro, started doing some swimming with her, cavaletti poles, making her do work on the yoga ball. So all those different types of things, almost like doggy Pilates. to really strengthen her up. And I sent the owner home with exercises, so a lot of controlled walking, not letting her run up and down stairs and on slippery floors. So we had to address quite a lot of the home environment as well. So making sure she doesn't slide or slip or jump off of furniture and things like that, I felt was very, very important. And then obviously I gave the owner some exercises to do at home, some homework, and teaching the owner how to stretch. So how to stretch out Lily's muscles. Because basically what happens is when you've got pain in the hindquarters, they start compensating. So all the back muscles and the front quarters, they start also getting stiff and tired. So we really, really had to do an overall treatment. And obviously me seeing her once to twice a week was not enough. She needed to be worked on, 10 minutes here during the day or 10 minutes there. And I felt that the owner really, really did what I asked her to do. And it was fantastic because there's been such an improvement. Lily's hindquarters have strengthened so nicely. She's now got really, really good musculature in her hindquarters. She's loose, she's strong, and she's doing the most fantastic heel patterns at the moment during her obedience work, and she's competing beautifully.
Out of interest, because you said she's 4 years, is that right? 4 years old?
5.
5 years old. Did the owner see any symptoms early on? Was this the first time she picked up that something was wrong?
Lily was rescued, so we don't know 100% sure, what she suffered with before the time. But as soon as the owner adopted Lily, she started taking her obviously to training, and then through all of this, you start picking up the little subtle signs of that when you ask her to sit, she doesn't really want to sit down, and when she sits, she's not sitting down square; she's sitting down with one leg flopping to the side. So all of this kind of started presenting itself from an earlier stage, but I feel that sometimes it's very easy to miss, especially in a dog that you're not 100% sure of their background. You could think it could be something that just happened. You don't know. But yeah, the owner did start picking it up, and as such then started putting her on joint supplements, and then consulted with a trainer. And then when she found that there must be something wrong, she took Lily to the vet.
Yeah, I think, with hip dysplasia, with hind limb lamenesses, sometimes it's quite difficult to pick up to the untrained eye. The forelimb lameness is a little bit, easier because you get the head bob, it's more pronounced. So often owners, it's only when they're really, really lame or really sore, they can't stand up, or that they'll actually pick it up. One of the things that I teach my clients to do is actually just to see how they're distributing their weights. And if a dog is standing with all 4 legs down square, I get the owners just to pull back slightly on their paws, and especially on the hind legs, you'll see that if you can move their paw, they're not putting that much weight, and that's usually the very first sign that there's something going on in the hips, those hip dysplasia cases. And so now you obviously on a maintenance. So are you still treating the dog now, or do you just see it every now and again if there's a problem?
Lily comes in once a month for treatment. So we started off in the beginning stages for probably the first 6 months. I saw her once a week, and then we tapered to every second week, and then we tapered to once a month. And now I see her once a month for maintenance. And then you can see, if the appointment somehow ends up going a little bit longer, you can see she starts getting a little bit tighter, and she starts getting a bit slower and things like that. And as soon as the owner sees it, she phones me, and then we move the appointment earlier. But basically, we see Lily on a once-a-month basis, and I feel that keeps her nice and strong. But I have to say, the owner, I feel that if you're going to put the dog on a maintenance program, the owner needs to do the homework. And Lily's owner has done the homework. She does it all the time. I see Lily at training as well, so I get to keep an extra eye on her, I suppose. But the owner is extremely good at picking up all the signs that I've shown her, and we take videos of her from the beginning and of her during her actual obedience classes, and as soon as we see that she's struggling, we put her back into a slightly more regular program.
Yeah, I mean, it's so important that the owner keeps up with all the strengthening exercises. So often you'll find that you'll do all the strengthening and then the dog seems to be fine, and the owners will keep up with it for a little bit, and then maybe 1 or 2 months they'll slacken off, and you can see the deterioration. So this maintenance is so important. What type of exercises, home therapeutic exercises, is the dog doing, Dom?
So I have specifically asked her to do cavalettis. So basically it's walking over poles. So everybody's got a broom and a mop in their house, and you just put them up on like some towels or some Coke cans or something like that, or some bricks, like Lily's got bricks at home. And basically we ask her to walk over them. And the main reason for this is obviously it's a proprioceptive aid. So it's going to, keep her aware of where her hindquarters are, where she's placing her feet. But it's also a strengthening exercise because she's got to go on three legs as she's walking over. And from there, then she does, the owner's got a yoga ball at home, and she's got to put her front legs on the yoga ball, and then she does sit to stand with her front legs on the yoga ball. She's not 100% comfortable with her full body on the yoga ball. She's not very happy with it. And when she's got a trance, they've got a dam, and Lily goes to go swim in the dam. And she goes on regular walks, controlled walks, and a lot of, little play exercises that you can do. You'll sit to stand while you're doing the feeding time. So when you're feeding them breakfast or dinner, ask them to do 3 or 4 sit to stands, or sit to down and then back up to a stand exercise. I feel it's just so quick. It takes you a minute extra during feeding time, and it's so simple and easy to do. And it works like a charm.
Yeah, I mean, I think that's the biggest thing is, for it to be sustainable to do the exercises. So I always say to my clients that there are 3 times that you could do it. The one is when they're eating. So exactly like you said. The other time for me with Sunshine, so I've got a dog that's got hip dysplasia, is when I go to the toilet, because most dogs will follow their owner to the toilet. And as you come out the door, there they are. So I quickly do some exercise. And then the other time is when you're waiting for the kettle to boil or the toaster, because you've always got some time. You're sort of waiting. So those are always good times to do exercises, and it's great that the owner is so involved. It really does help. So I see we've got some people commenting. Hey, Morris, she's listening from the US while I'm at work. Thanks for joining us. If you guys have any questions, please just post them in the comment section, and we'll do our best to answer them. And Tom, I want you to chat a little bit about, obviously when dogs have hip dysplasia, either we do the conservative approach, but sometimes there are dogs that are operated on. And I am a member of a few groups. I've got my own canine hip dysplasia group for pet owners. And I find that it's a big rush sometimes to operate, and especially to do a femoral head amputation. And so many young dogs, sort of 10 to 12 months of age, and they're having femoral head amputations. Do you do a lot of rehab on these type of cases, or are most of yours conservative treatments?
Sorry, say that last bit again.
Do you do a lot of rehab on femoral head amputation for those hip dysplasia cases that have been operated on, or are most of the cases you're seeing where you're doing rehab for conservative treatment, so without surgery?
I see a mix of both. So I feel that it depends, first of all, on the severity of the hip dysplasia. So if it's not so severe, it can be treated with conservative treatment. But unfortunately, there is a limit to how much work we can do and keep the dog happy. So in my honest opinion, quality of life is the deciding factor when you've got the decision between conservative treatment and surgery. If we decide the conservative treatment route, will the dog's quality of life be good, or will the dog be consistently in pain, consistently lame? Then I decide, well, then it's time to consider surgery. I feel that the young is the to adapt to the femoral head resection, but also because they're young, they're not obviously as strong and stable. So it's very difficult, depending on the dog, if it's a heavier breed or a lighter breed, how easily they adapt. I feel that with femoral head resection, it is necessary to do rehab in the beginning stages, but again, it can move on to a maintenance program where you see them once a month or once every few months, bearing in mind that the owner does do maintenance work.
Yeah, so I mean, this is just my personal opinion. So for me, I'm not very fond of a femoral head amputation, and there are cases that I would recommend it as an end stage. But I sort of feel that dogs are better off having hip joints than they are not having them. And obviously, in an ideal situation, you would have, in those kind of cases, a total hip replacement. But there's always this problem with finances because it costs so much money. And I always recommend to my clients to try the conservative approach first, because you can always do a femoral head amputation and you can always do a total hip replacement at a later stage. So give the conservative approach a try to see whether for example, your case now has responded so well. And I've actually had cases where at sort of 8 months of age, total hip replacements on both sides has been recommended, and they haven't had any ops at all. The conservative approach has worked well, but like you say, it all comes down to quality of life. So if you're able to manage their pain and you're able to strengthen them enough for them to have enough quality of life, then the conservative approach works well. But I think it's always a good try conservative, and then if it doesn't work, like you say, then go ahead for surgery.
No, most definitely. I think conservative treatment, a lot of people don't always know about it, and I feel it's very, very important to let the vets know that we are here and we are available to help, and we are there to help the dogs in a positive manner. And I feel that as soon as we can, get our profession quite out there so that people are aware, because a lot of people say they don't know that we exist. So I feel that the more that we get out, we show them that we can help these animals, and that there is an alternative. Replacement is extremely expensive, and a lot of the dogs really struggle with femoral head resection. They really struggle to bounce back, and it's a lot of work. So if the conservative treatment is available and you've got someone in the area to help you, then do it. And even if there isn't someone in the area, I know that some people really struggle. They have to drive very far to come and see us. We can always work via videos and messaging, and there's a lot of different ways that you can communicate with the owners to say try this or try that. And it's very, very nice that we've got these Facebook Live options, so they can actually ask questions, and if they're too shy to ask or unsure, then they can ask.
Yeah, I think, with the conservative approach, there's also a lot of things that pet owners can do, with regards to the environment. And, I find, when I look at all the questions on some of these Facebook groups, it's really always about what can I give them and what operation can I do. But there's so many other things. So I always recommend my clients to have a look at the environment. So have a look at your floors. How slippery are the floors? Have you got laminates, tiles, or wooden floors? Because often this is really, really difficult for a dog with hip dysplasia, because they've got such weak muscles on their hind legs. They're actually unable to keep their legs together, and their legs seem to splay apart. So making sure you've got mats that they can walk to, making sure where they eat, they're not actually slipping. There are also products that you can use, little things to put on the toes, toe grips and sticky paws to prevent them from slipping. But sometimes just a few changes to the environment can make a massive difference to the dog's mobility and its pain. So we underestimate sometimes, I think, the environment and how that can contribute to pain. So if a dog has just one slip and falls down onto its side, it can, that can cause pain in the other side or the hip and the shoulder or the back. It causes all these other secondary problems that the dog needs to deal with. And the other thing is stairs, just sometimes blocking off the stairs or having a ramp or just making it easier for a dog to get up and down stairs or onto couches if there are dogs that are allowed to. My dogs are on beds and couches, so they can jump up. And also getting in and out of cars. So these are the things really that pet owners must have a look at. And I don't know if you've got any other advice with regards to environment, like beds. I mean, what kind of beds do you normally suggest for hip dysplasia cases, Dom?
Well, depending obviously on the owner, some owners really don't. The softest beds as possible. So, and then obviously something that's a little bit higher off the ground, so that there's a little hammock type of bed that you can use, and you put a really nice soft mattress on it. Easier for the dogs to get up and down because they don't normally go up and again. So it's a little bit easier to get on and off. Easier, but also not something that's so soft that they can't actually get up.
Yeah, I like those. They're called hound sleepers, I think. Is that what you're talking about?
I think so.
Yeah.
They are really, really nice.
Yeah.
Around the house, very important. The stairs, if the owners do sleep upstairs and the dog comes up upstairs, try and block off the stairs, and then when you go up, if it's a small dog, carry them up. If it's a big dog, let them up and down the stairs once a day, not 10 times a day that they are permanently up and down the stairs, because if they do slip and fall, it's extremely painful for them, and it puts their rehab back quite a bit sometimes when they do that.
Good advice.
Yeah.
I've got a few people mentioning, hey, Angela, great to have you online. Some people watching in the UK. Thanks for coming online to listen to us. Guys, if you have any questions, please just put them in the comment section. We'll be happy to answer them. Dom, I wanted to chat to you a little bit about exercise. So, I mean, here in Cape Town where we are, we obviously have loads of beaches, and all the owners just want to take their dogs to the beach. I actually recommend to my clients that have got dogs with hip dysplasia that the beach is out. And I find that it's so hard for them to walk in that soft sand. And if you can get them straight down to the hard sand, down by the water, then they tend to do okay. But that soft sand causes such discomfort in their hip flexors. These are the muscles that are in the front of their hips. And they're usually very tight as it is. And so I always say to them, no sand, and let's go on sort of harder terrain. You also based here, so you probably have the same problem, everyone going to the beach, and then the next day the dog is so sore they give you a call.
Yes, no, definitely. At the same time, there are dogs and quality of life, so you do want them to have fun, but they can have fun at the park or on a nice grassy field where it's slightly even terrain or harder ground. I feel that the sand is extremely it's difficult because the dogs really come off there quite painful. If you can get them down to the hard ground and you can keep them on the hard ground, then it's usually okay. But getting them down, and they usually end up flying around there in the thick sand because it's lots of fun. It's fun at that moment, but an hour or two later, that poor dog is extremely sore. Always recommend it. I try to tell the owners, please not. But you can't always tell the owners. You can tell them or recommend something, but they don't always listen, unfortunately.
And also, dogs will be dogs sometimes. So, if I think about myself, if you've ever done like a 5K beach run in comparison to a 5K run on the road, the difference is unbelievable. Running in the sand is really, really, really hard work for the muscles. And the problem is that their muscles are generally weak and they are tight in other places. So it's not ideal for them. Dom, thank you so much. I think we've just been talking so much. I don't see any direct questions, just some comments, people saying thank you so much. So you guys, if you're watching this as a recording and you have any questions, please just post in the comment section and we'll be happy to answer them. Dom, thanks so much for giving up your time. If there are people in Cape Town that are looking for you to treat their dog with hip dysplasia, how can they find you?
Well, you can find me on my Facebook form Animal Therapy. You can always give me lots of different ways. You can find usually plastered all over Facebook. We usually have like special, for Christmas and for Black Friday. Always just let me know. If they're competitive, find me usually working. But yeah.
Awesome. Dom, thanks so much. Thanks to everyone who came online. Have an awesome day.
Thank you.
Bye-bye.
Bye-bye.